Hello, dear viewers. It's a pleasure to meet you. I am your host, a keen explorer of health and wellness. Today, we're going to delve into a topic that has touched so many lives globally, a topic that calls for our collective attention and understanding: cancer. Cancer is not just a word or a disease, it's an experience, a journey that millions embark upon, often without a choice. It's a phenomenon that alters not just the lives of those diagnosed, but also those in their orbit. It's a topic that's essential to discuss, not to instill fear, but to foster understanding and awareness. As we navigate this complex landscape, we'll make an attempt to unravel the mystery of what cancer actually is. We'll delve into the microscopic world of cells and mutations, introducing you to key terms that'll help you better comprehend this disease. We'll then cast a spotlight on some of the most common types of cancer, discussing their risk factors and emphasizing the crucial role of early detection. We'll also explore how our lifestyles and even our genes can influence our risk, offering practical tips to fortify your defense against this disease. Next, we'll look at the importance of regular health checkups and screenings, demystifying common methods used for early detection. We'll also touch upon the various treatment options available, the importance of a multidisciplinary approach, and the exciting promise of emerging therapies. We'll discuss the emotional and psychological aspects of living with cancer, the role of support networks, and resources available to help cope with the diagnosis. Lastly, we'll highlight the ongoing advancements in cancer research and how you can contribute to this cause. Our aim is to empower you with knowledge, instill hope, and encourage a proactive approach towards health. The road to understanding cancer is long and winding, but it's a journey we must undertake together. Now buckle up as we embark on this informative journey about cancer. First off, what exactly is cancer? You've probably heard the term bandied about quite a bit, but what is it really? Cancer, in its most basic definition, is the uncontrolled growth of cells in our bodies. Normally, our cells follow a regulated cycle. They grow, divide, and die in a controlled manner. This process is vital to our health, allowing us to grow, heal, and replenish cells. However, sometimes this process goes awry. When cells start to grow or divide too quickly or refuse to die when they should, we get what's known as a tumor. This is a massive tissue that's formed by an accumulation of abnormal cells. Now, not all tumors are cancerous. Those that aren't are called benign tumors. They can still cause problems depending on their location, but they don't spread to other parts of the body. On the other hand, malignant tumors are what we typically refer to as cancer. These are the dangerous ones because they can invade nearby tissues and spread to other parts of the body, a process known as metastasis. Once cancer cells have metastasized, they can form secondary tumors, making the disease much more difficult to treat. So, what causes these cells to go rogue in the first place? Well, the answer lies in our DNA. Our DNA is like an instruction manual for our cells, guiding them in their growth, division, and death. Sometimes, due to various factors, these instructions can get mixed up. This is known as a mutation. A single mutation won't necessarily cause cancer, but a series of mutations over time can lead to uncontrolled cell growth and, eventually, a tumor. You might be wondering what causes these mutations. The truth is, it can be a variety of things. It could be something inherent, like your genetic makeup, or something external, like exposure to certain chemicals or radiation. Even some viruses can cause mutations. It's a complicated interplay of factors that can lead to cancer, and we're still learning more about it every day. Another term you may have heard in relation to cancer is carcinogen. A carcinogen is anything that can cause cancer, usually by inducing mutations in our DNA. This could be anything from tobacco smoke to ultraviolet rays from the sun. It's important to note, however, that exposure to a carcinogen doesn't guarantee you'll get cancer, just as avoiding carcinogens doesn't guarantee you won't. It simply increases or decreases your risk. It's also crucial to understand that cancer is not a single disease. There are over 200 different types of cancer, each with its own set of characteristics, risk factors, and treatment options. Some cancers are more common than others, like breast, lung, prostate, and colorectal cancers. Some are more deadly, while others have higher survival rates. It's a lot to take in, isn't it? Cancer is a complex, multifaceted disease that can affect anyone, anywhere. It's a global health issue that claims millions of lives each year. But there's also hope. Research is ongoing, and we're making strides in understanding, preventing, and treating this disease every day. So, while the word cancer may sound scary, remember that knowledge is power. Understanding what cancer is, how it develops, and what causes it is the first step in fighting it. In the coming sections, we'll delve deeper into the different types of cancer, their risk factors, and the importance of early detection and prevention. We'll also explore the various treatment options available and discuss how to live with cancer, or support someone who is. In a nutshell, cancer is a complex disease, but understanding its mechanics is the first step towards combating it. Cancer comes in many forms. Some types are more common than others. Cancer is a complex disease with over 200 individual types identified. However, some types are more prevalent than others. Today, we delve into the most common types of cancer, their associated risk factors, and the all-important role of early detection. Among the most common forms of cancer, breast cancer stands out. It affects both men and women, but it is far more common in women. Risk factors range from age, family history, and certain genetic mutations to lifestyle factors like diet, physical activity, and alcohol consumption. Early detection is vital, as it often allows for a wider range of treatment options and a better prognosis. Next, we have lung cancer, which is among the leading causes of cancer deaths worldwide. It's primarily caused by smoking, though non-smokers can also develop this type. Exposure to secondhand smoke, radon gas, and other hazardous substances can also increase your risk. Remember, quitting smoking at any age can significantly reduce your risk of developing lung cancer. Prostate cancer is another common type, primarily affecting men, particularly those above the age of 50. Risk factors include family history, race, and certain genetic changes. A diet high in red meat or dairy products might also increase the risk. Regular screenings such as prostate-specific antigen, PSA tests, can aid in early detection. Colorectal cancer, involving the colon or rectum, is also among the most common cancers. Age is a significant risk factor here, with the majority of cases occurring in people over 50. Other risk factors include certain genetic syndromes, family history, diet, lack of regular physical activity, alcohol consumption, and tobacco use. Regular screenings such as colonoscopies are key to catching this type of cancer early. Skin cancer, specifically melanoma, is also widespread. Exposure to ultraviolet UV radiation from the sun or tanning beds significantly increases the risk. Regular skin checks for new or changing moles or skin spots can help detect this cancer early. Now, let's not forget about stomach or gastric cancer. Risk factors include infection with Helicobacter pylori bacteria, long-term stomach inflammation, smoking, certain dietary factors, and family history. Although it's less common in many parts of the world, it's a leading cause of cancer-related deaths globally. And finally, we have liver cancer. Chronic infection with hepatitis B or C virus is a major risk factor. Others include cirrhosis, certain inherited liver diseases, diabetes, obesity, and excessive alcohol consumption. By now, we've covered the most common types of cancer. But remember, there are many others. Each comes with its own set of risk factors and symptoms, underscoring the necessity of regular checkups and screenings. Now let's talk about early detection. It plays a crucial role in managing cancer. Many cancers, when detected early, are more likely to respond to treatment, leading to a better prognosis. Regular screenings, awareness of your body, and prompt attention to any changes can make all the difference. For instance, mammograms are instrumental in detecting breast cancer early. Colonoscopies help identify precancerous polyps in the colon or rectum, which can be removed before they turn into colorectal cancer. Regular skin checks can catch melanoma at an early stage when it's most treatable. Remember, each type of cancer has its own screening guidelines based on factors like age and risk. It's important to discuss these with your healthcare provider to determine the best approach for you. In closing, it's essential to note that while some risk factors like age and genetics are out of our control, many others are lifestyle-related and can be managed. A balanced diet, regular exercise, limiting alcohol, avoiding tobacco, and protecting against UV radiation can go a long way in reducing cancer risk. Remember, early detection can be a lifesaver. So stay in tune with your body, attend regular screenings, and never hesitate to report any unusual changes to your doctor. Your proactive steps today could make a world of difference tomorrow. While we cannot control all risk factors, we can certainly influence some. It is with this understanding that we delve into the fourth segment of our discussion on navigating cancer. In this segment, we'll be exploring some of the lifestyle factors that contribute to cancer risk, discussing the role of genetics, and providing practical tips for cancer prevention. Now let's first talk about lifestyle factors. These are the habits and behaviors that we adopt and practice in our day-to-day lives that can either increase or decrease our risk of developing cancer. Among these, diet, smoking, and physical activity are some of the most significant. Let's start with diet. A balanced and nutritious diet is pivotal in maintaining overall health and reducing cancer risk. Consuming a variety of fruits, vegetables, whole grains, and lean proteins not only provides the body with necessary nutrients, but also helps maintain a healthy weight. On the flip side, a diet high in processed foods, red and processed meats, and sugar can increase the risk of certain types of cancer, such as colorectal and breast cancer. Next, we have smoking. It's no secret that smoking is one of the leading causes of many types of cancer, including lung, mouth, throat, and esophageal cancer. The harmful chemicals in tobacco smoke damage cells in our bodies, leading to mutations that can result in cancer. Quitting smoking, or better yet, never starting, is one of the most effective ways to reduce cancer risk. And then there's physical activity. Regular exercise helps maintain a healthy weight, boost the immune system, and lower the risk of certain types of cancer, including breast and colon cancer. Whether it's a brisk walk, a vigorous gym workout, or a relaxing yoga session, any form of physical activity is better than none at all. Now let's shift gears and talk about genetics and family history. While lifestyle factors play a significant role in cancer risk, it's important to remember that genes also have a part to play. Certain types of cancer, such as breast, ovarian, and colorectal cancer, can run in families due to inherited gene mutations. However, it's key to note that having a family history of cancer doesn't mean you will definitely get cancer. It just means your risk may be higher than average. So, how can we prevent cancer? Well, prevention starts with awareness and understanding. Knowing your family history can help you understand your personal risk and take steps to reduce it. Regular screenings and checkups can help detect cancer early when it's most treatable. Taking proactive steps to lead a healthy lifestyle, such as eating a balanced diet, exercising regularly, quitting smoking, and limiting alcohol intake, can significantly reduce your risk. But let's not forget about vaccinations. Certain types of cancer are caused by viruses such as human papillomavirus, HPV, and hepatitis B and C. Vaccines are available to protect against these viruses, and getting vaccinated is a powerful tool in cancer prevention. Lastly, let's talk about sun safety. Skin cancer is one of the most common types of cancer, and it's largely preventable. Protecting your skin from the sun's harmful rays by wearing sunscreen, seeking shade during peak sun hours, and wearing protective clothing can significantly reduce your risk of skin cancer. Prevention is not just a buzzword, it's a proactive step towards health. Remember, while we cannot control all risk factors, there are many things we can do to reduce our risk of cancer. It's about making informed choices and taking proactive steps towards leading a healthier lifestyle. So let's take that step together, towards a future where cancer is no longer a threat. Early detection is often the best defense against cancer. This statement is not merely a catchy phrase, but a powerful truth that underscores the critical role of early detection and screening in the fight against cancer. When we talk about early detection, we're referring to the process of finding cancer before symptoms begin to show. This is crucial because cancer is often more manageable, and the chances of successful treatment are higher when it's caught in its early stages. Now, let's delve into the various screening methods that aid in early detection. These methods are designed to detect abnormalities that could be indicative of cancer, even before you may feel anything is wrong. First up, we have mammograms, a type of X-ray that's used primarily to screen for breast cancer. Mammograms can often detect lumps in the breast or irregularities even before they can be felt through physical examination. For women of average risk, regular mammograms are typically recommended starting at the age of 40 or 50, depending on your doctor's advice. Next, there's the PAP test, or pap smear, which is a simple procedure used to detect cervical cancer in women. During a PAP test, cells are gently scraped from the cervix and examined under a microscope to check for any abnormal changes. It's recommended that women start getting regular pap tests from the age of 21. Then we have colonoscopies, which are used to detect colorectal cancer. A colonoscopy allows doctors to examine the entire length of the colon and rectum for polyps, or abnormal growths that could eventually become cancerous. Regular colonoscopies are typically recommended starting at age 50 for both men and women, although this can vary depending on individual risk factors. Prostate cancer, one of the most common cancers in men, can be detected early through a prostate-specific antigen, or PSA test. This blood test measures the level of PSA, a protein produced by the prostate. Elevated levels could indicate the presence of prostate cancer. Lung cancer, another leading cause of cancer deaths, can be detected early using a low-dose computed tomography, or LDCT, scan. This type of screening is generally recommended for people who have a high risk of lung cancer, such as heavy smokers or those with a significant family history of the disease. These are just a few examples of the many different types of cancer screenings available. There are others, like skin checks for skin cancer, blood tests for certain types of leukemia, and more. The type of screening you need and how often you need it depends on various factors, including your age, gender, family history, and lifestyle habits. But remember, screening tests are not perfect. They have their limitations and can sometimes give false positives or false negatives. That's why it's important to discuss the benefits and risks with your healthcare provider and make an informed decision. While we're on the subject, let's not forget the importance of regular health checkups. These checkups are not just about cancer screenings, but about maintaining overall health. They provide an opportunity for your doctor to catch potential health issues early and guide you on the path to good health. Regular self-examinations are also an essential part of early detection. For instance, women are encouraged to perform regular breast self-examinations, and men are advised to conduct regular testicular self-examinations. These simple checks can help you become familiar with your body and notice any changes that may need medical attention. In conclusion, early detection plays a pivotal role in the fight against cancer. It provides the best chance for successful treatment and can save lives. However, it's important to remember that screening is just one part of a comprehensive approach to cancer prevention. It should be complemented by a healthy lifestyle, regular checkups, and awareness of your body. Your health is in your hands, so make regular screenings a priority. This is not just a call to action, but a reminder that you have the power to take control of your health. So, take this knowledge, empower yourself, and remember, the earlier the detection, the better the protection. If diagnosed with cancer, knowing your options is crucial. It is a phrase that rings true for everyone who has been handed that diagnosis. But what does it really mean? Let's delve into the world of cancer treatment and explore the options that are available. At the heart of cancer treatment are three main techniques: surgery, chemotherapy, and radiation. Surgery is often the first option, particularly if the cancer is localized and hasn't spread. It involves removing the tumor and some surrounding healthy tissue to ensure no cancer cells are left behind. On the other hand, chemotherapy uses drugs to kill cancer cells. It can be administered in different ways, such as orally or through an injection. It's a systemic treatment, meaning it affects the entire body. Hence, it's often used when cancer has spread beyond its original location. Radiation therapy, like surgery, is a local treatment. It uses high-energy particles or waves to destroy or damage cancer cells. It's often used in conjunction with other treatments to shrink tumors before surgery or kill any remaining cells afterward. However, cancer treatment isn't a one-size-fits-all approach. It requires a multidisciplinary team of healthcare professionals who work together to create a personalized treatment plan. This team may include oncologists, surgeons, radiation therapists, dietitians, and social workers, among others. Each brings their expertise to the table, ensuring that all aspects of a patient's health and well-being are considered. In recent years, medical advancements have led to the emergence of newer treatment options. One of these is immunotherapy, a treatment that harnesses the power of your own immune system to fight cancer. It works by helping your immune system recognize and attack cancer cells. Another promising development is targeted therapy. Instead of attacking all rapidly dividing cells like chemotherapy does, targeted therapies specifically attack cancer cells by focusing on the specific proteins or processes that allow these cells to grow and multiply. Then there's hormone therapy, commonly used in cancers that are hormone sensitive, like certain types of breast and prostate cancer. This type of therapy works by blocking the body's ability to produce hormones or interfering with how hormones behave in the body. Let's not forget about stem cell transplant, a procedure that restores the blood-forming stem cells in people who have had theirs destroyed by very high doses of chemotherapy or radiation therapy. It's often used for cancers such as leukemia and lymphoma. There's also precision medicine, an approach that allows doctors to select treatments that are most likely to help patients based on a genetic understanding of their disease. This could mean designing a treatment plan that targets specific genes or mutations within the cancer cells. It's important to note that these treatments can be used alone, but they are often most effective when used in combination. The choice of treatment depends on many factors, including the type and stage of cancer, possible side effects, the patient's overall health, and their personal preferences. In the face of a cancer diagnosis, understanding your treatment options can be empowering. It allows you to take an active role in your care, ask informed questions, and make decisions that align with your personal values and goals. Remember, there's no right or wrong choice when it comes to cancer treatment. What matters is that you have all the information you need to make the decision that's right for you. Don't hesitate to ask your healthcare team any questions or voice any concerns. They're there to help guide you through this journey. In the end, the goal of cancer treatment is not just to treat the disease, but to maintain the highest possible quality of life for the patient. This includes managing side effects, providing emotional support, and addressing any other issues that may arise. And as we look forward to the future, we remain hopeful. With ongoing research and advancements in medicine, we're constantly finding new ways to treat cancer more effectively and improve the lives of those affected by this disease. Understanding your treatment options is empowering. It's a statement that holds a lot of weight. And it's a statement that we hope resonates with you as we continue to navigate the complex world of cancer together. A cancer diagnosis is life-changing, but you are not alone. Living with cancer is an experience that is different for everyone. It's a journey filled with emotional highs and lows, moments of clarity and confusion, and above all, a test of resilience. But remember, it's a journey that you don't have to walk alone. The emotional and psychological aspects of a cancer diagnosis can be overwhelming. There's fear, anxiety, anger, and sometimes even guilt. These emotions are normal, and it's important to acknowledge them. It's okay to feel scared, to feel upset. It's okay to ask, why me? What's vital is not to let these emotions consume you. A key part of living with cancer is learning how to cope with these feelings. Some people find solace in writing or art, putting their thoughts and feelings onto paper or canvas. Others may find comfort in physical activity, using exercise as a way to regain some control over their body. And some people may turn to meditation or mindfulness, finding peace in the present moment. But remember, everyone copes differently. What works for one person might not work for another, and that's okay. It's about finding what works for you, what helps you navigate this journey. Support networks play an invaluable role in this journey. These networks can be made up of family, friends, healthcare professionals, or even fellow cancer patients. They provide emotional support, practical help, and a sense of community. They are the people who can sit with you in silence, hold your hand during treatments, or simply listen when you need to talk. Support groups, both online and offline, can be particularly helpful. These groups connect you with people who are going through similar experiences. They provide a safe space to share your fears, your hopes, your frustrations, and your victories. It's a place where you can say, "I'm scared," and hear the words, "I understand," in return. Living with cancer also means dealing with the physical changes that come with treatment. These changes can affect your self-image and self-esteem. But remember, it's okay to ask for help. Reach out to your healthcare team for advice on managing these changes. They can provide you with resources and refer you to professionals who specialize in helping cancer patients deal with these challenges. There are also numerous resources available that can provide information, advice, and support. These include cancer charities, helplines, and websites. Many of these organizations offer services such as counseling, financial advice, and practical help. Living with cancer is a journey, and it's a journey that you don't have to walk alone. Reach out to those around you. Seek help when you need it. Use the resources available to you. And remember, it's okay to have bad days. It's okay to feel overwhelmed. It's okay to ask for help. But also remember, you are more than your cancer. You are a person with dreams, passions, and love to give. You are a fighter, a survivor, and every day you are proving just how strong you truly are. With the right support, cancer is a journey you don't have to walk alone. Progress in cancer research gives us hope. It's a sentiment that resounds within the scientific community and beyond, touching the lives of those who have been impacted by cancer. Cancer research is a vast and complex field, brimming with dedicated scientists, researchers, and doctors who are unwavering in their quest to unravel the mysteries of this disease. Their work covers a broad spectrum, from understanding the basic biology of cancer cells, identifying risk factors, developing new treatments, to improving patient care. Each discovery, each breakthrough, brings us a step closer to a world where cancer can be effectively treated, or perhaps even prevented altogether. But these advancements don't just occur in isolation. They're the result of years of meticulous research, rigorous testing, and most importantly, substantial funding. That's where cancer advocacy organizations step in. These groups play a crucial role in supporting cancer research. They raise funds, increase awareness, and advocate for policies that support cancer research and patient care. Groups like the American Cancer Society, Cancer Research UK, and the World Cancer Research Fund, to name a few, contribute immensely to this cause. They not only fund research, but also provide resources for patients, survivors, and their families. Yet, these organizations can't do it alone. They rely on the support of individuals like you. Your contribution, whether it's making a donation, participating in fundraising events, or simply spreading awareness about cancer, can significantly bolster the fight against this disease. While we're on the topic of participation, let's talk about clinical trials. Clinical trials are a critical part of cancer research. They are the bridge that connects the lab to the clinic, allowing new treatments to be tested and refined before they are made available to patients. Participating in a clinical trial can offer many benefits. It provides access to potentially effective treatments that are not yet widely available. It also contributes to the broader understanding of cancer and helps improve treatment options for future patients. However, it's essential to remember that clinical trials also come with uncertainties and potential risks. Therefore, it's always crucial to have in-depth discussions with healthcare providers and loved ones before deciding to participate in a clinical trial. In this vast and complex battle against cancer, each one of us has a role to play. The researchers, the doctors, the advocacy organizations, and you, the individual. Together, we can accelerate the pace of progress, bringing us closer to a future where cancer is no longer a looming threat. Remember, your support can make a tangible difference in cancer research. Each step we take, no matter how small, is a stride towards a world where cancer is no longer a sentence, but a challenge we know how to overcome. We've covered a lot of ground today. Indeed, we've journeyed through the complex landscape of cancer, unraveling its mysteries, and exploring ways to prevent, detect, and manage it. We began by defining cancer, understanding how it develops from normal cells that have gone astray. We introduced key terms like tumors and metastasis, helping us to appreciate the intricacies of this disease. We then shone a spotlight on some of the most prevalent types of cancer, including breast, lung, prostate, and colorectal cancers. For each, we learned about the associated risk factors and emphasized the critical role of early detection. Our exploration continued with a deep dive into risk factors and prevention. We discovered how lifestyle choices, such as diet, smoking, and physical activity, can influence our cancer risk. We also discussed the role of genetics and family history, and provided practical tips for cancer prevention. We emphasized the importance of early detection and screening, explaining common methods like mammograms and colonoscopies. We encourage regular health checkups and screenings, reminding us all that early detection can save lives. We navigated through the various treatment options available, from surgery to chemotherapy to radiation. We underscored the importance of a multidisciplinary approach and touched on the exciting world of emerging therapies and personalized medicine. We confronted the emotional and psychological aspects of living with cancer, discussing the role of support networks for patients and their families. We highlighted coping strategies and shared resources available to help navigate this challenging journey. Finally, we celebrated the vital work of cancer research and advocacy. We encouraged support for these organizations and shared information about participating in clinical trials. We hope this knowledge empowers you and those around you. Remember, knowledge is power, and sharing this power can make a difference. Reach out to health organizations or online resources for more information and support. Thank you for joining us today. Together we can envision a future without cancer.